Hi everyone, welcome to week 3 of HFR 8123 Qualitative Research Methods. This week we are going to dive into some specific approaches for qualitative research design. Your assigned reading was chapters 4 and 5 in Creswell and Poth, and those chapters give an overview of 5 main approaches to qualitative research. In addition, I posted an article on Blackboard that talks about another form called qualitative description. So let's start with a brief review of the 5 approaches. I know you've read this in your chapters, so I'm not going to go into it in great detail, but just provide a couple of key points for each approach. Before we do get into that, I want to just make this distinction between design and methods. They are not the same. Research design is kind of an overall approach, but it doesn't specify what kind of data need to be collected or used and how. In some cases, it implies an analytical approach, but again, it doesn't limit or specify how the data collection happens. So there's that distinction. I just want to make that clear up front. So let's start with narrative research. Narrative, as the name implies, is an emphasis on stories and personal accounts of an experience. Like a story traditionally has, there is a beginning and a middle and an end of a narrative. Often we have a chronology as well. We look, to the past, to the present, to the future. There is, in a good narrative, we have kind of the trouble happens. There's some decision point that happens to the character. A narrative in research is often co-constructed between the researcher and the participant. The analysis may focus on the theme, the structure of the story, or the production of the story. In fact, the dialogue between either the researcher and participant or among participants in a group interview setting. And it's really a focus on this study of written text. The emphasis is on the interpretation and context, and also this shifting between looking at the overall whole of the arc of the story and then zooming in to the smaller pieces of it. This might not all make a lot of sense now, but hopefully once you've done your reading and we have a little bit of online discussion, we can clarify any questions you have. As an example of a narrative study from the occupational therapy literature, I've highlighted the aim of the study and why narrative was selected, because the specific aim of the study was to explore how agency is enacted in occupations with others and how it evolves over time. And to explore and demonstrate this, they use the story of a woman in the context of aging and living with late life depression. So again, they're using the story to explore this research question. So next on the list of the 5 approaches is phenomenology, which, in addition to being just a fun word to say, that sometimes we stumble over, but hopefully I won't in this lecture. It's really about digging into the shared lived experience of a concept or phenomenon. So for instance, what is the shared experience of people who have a certain condition or undergo a certain life experience? It really grew out of philosophy, and one of the elements that really came out of phenomenology as an approach is this concept of bracketing, where as a researcher, we've talked previously about the researcher also being the instrument of data collection and analysis. So in phenomenology that emerged this idea of researchers bracketing their own experience by identifying what it is and how it might influence their interpretation. And again, an example of a phenomenological study is where the central question was, what is the experience and meaning of doing for people who are recovering from mental illness? So what the researchers in this case were interested in was the shared experience for this particular population of people recovering from mental illness. The third approach that your book talks about is grounded theory research. And the purpose of grounded theory is to generate a theory of process or action that is quote unquote grounded in data. So when we talk about theory, sometimes we think of really grand type of theories, but this is really substantive theory that is specific to a particular situation or circumstance. Grounded theory gives us a commonly used analysis approach, which is very structured and is often borrowed in other approaches or in descriptive analysis, which I'll talk about in a few minutes. It uses this constant comparative method, and it's very iterative. And as we get into learning more about data analysis and qualitative, we'll see it's always iterative. We have to go back over and back over. But traditionally, grounded theory analysis has three key steps. Open coding, which is kind of initially putting the pieces of data in different categories, and then axial coding, which is identifying a category, picking one category and going back to the data to create new categories around that concept, and then selective coding, which involves developing hypotheses to explain the relationship between the categories in the model. There are variations in how structured this can be, but this is the general overall approach. And again, we'll talk much more about data analysis in a few weeks. So an example of a research question that might be appropriate for grounded theory is highlighted in this study here, that the present study aimed to explore the use of intuition by occupational therapists practicing in the mental health area, where therapists might be expected to rely strongly on interaction and connection with patients in their clinical reasoning to guide practice. So they really wanted to understand how this was functioning in practice and develop a theory of how it was functioning. So fourth of the 5 approaches is ethnography. And ethnography is actually both the process and the product of this type of research. Ethnography, the main thing to remember is it's a focus on culture, and a cultural sharing group is generally the unit of analysis. And when I say cultural sharing group, it can be, in more traditional ethnographies that we get from anthropology, we might think of, cultural groups like tribes from different regions of the world, but also it can be the culture of an institution, it can be the culture of a profession, a family, so the cultural sharing group can be really widely interpreted, certainly not limited to ethnic groups. And ethnography gives us the practices of participant observation and fieldwork, in that the researcher often just has to spend a lot of time observing the group that they're studying. It's often very immersive, and in that kind of participant observer role, the analysis includes both trying to get the insider perspective from kind of being part of the culture, but also being an outsider and as an observer. Part of ethnography also includes writing up a thick description. So what we mean by thick description is that we get as much detail as possible. We get a really rich, detailed report of what's happening in that setting. An example of an ethnographic study in healthcare was a study around therapists' food rituals that were created and negotiated through their conversations and their role and function in the organization of their practice. So in this case, the cultural group was a group of therapists in a particular setting. So case studies are the last of the 5 approaches addressed by Cresswell and Poth, and they focus on an analysis of a bounded system. This could be a single patient, an event, a community, an institution, and it's really just focused on doing a deep dive into understanding what was happening in that circumstance, in that kind of bounded system or entity. Often case studies will include quantitative as well as qualitative approaches because it's really, again, about that deep dive into one particular entity. This article represents an example of a case study research, and in this case, the research question was around capturing patient, provider, and caregiver perspectives about high-quality, patient-centered care to diverse populations within occupational therapy. And they focused on just a particular case. Now, there are not just 5 ways of doing qualitative research. I'm going to introduce a couple others that aren't really focused on in the book so much, but I just want you to be aware that that these 5 are not the end-all be-all. They're certainly the foundation of a lot of what we have of qualitative research, but they're not the only things out there. So qualitative descriptive research is often called actually the most common type that is used in applied fields. It is really, the overall purpose of it is to just understand how people make sense of their lives and experiences, and to do so by providing a thorough description. The researcher's interpretation is limited in these kinds of studies. Sometimes this is also called basic qualitative research, and it's not always called out as qualitative descriptive, but you can kind of spot it where the analysis is more focused on just a very thorough description, but not necessarily a lot of interpretation. Do that one. An example of a qualitative descriptive study is, and it was specifically called out as that, is about youth with disabilities, and they wanted to explore what spirituality meant to these youth, and understanding what they do to keep their sense of spirituality strong, how they link it with their quality of life, and the relationship of their spiritual beliefs to those of their family. So in this case, the researchers were really just interested in doing a good description and not necessarily bringing one of those other perspectives to the question. We also have action research, which is it can use a number of different methods, but action research has this additional goal of solving a problem during the study. Often it focuses on a problematic situation and engages the participants almost as co-investigators. And quite often action research will be partnered with people in the community who are participants but have a pretty big say in how the study gets done. Some categories you might see are technical action research, practical action research, or critical, and in critical meaning they're challenging justice or power structures. An example of an action research is this was a case study approach, but using an action research perspective. It was a Chicago-based project that documented the experiences and concerns of disabled people attempting to transition out of nursing homes to the least restrictive community living, and actively involving the participants in empowerment and systems and policy change program. So it was a case study, but there was this additional goal of changing something or solving this problem, which makes it action research as well. You'll also in the literature see qualitative synthesis, and these can be done a number of different ways, but it's really a systematic process of incorporating study findings it's comparable to a systematic review in quantitative studies, but the researchers will look across a number of published qualitative studies and try to collectively interpret the findings. An example of this the studies came out a couple years ago, but it was about stroke survivors' experiences of physical rehabilitation, and the aim of the review was to synthesize and report the perspectives, experiences, and preferences of stroke survivors undergoing physical rehab in inpatient settings. And this study had the additional goal of generating new insights for practice. And to wrap up this lecture, sometimes you're going to see qualitative approaches mixed together. And it depends on what the research goals are, but in this published study, the data are part of a 3-year ethnographic mixed methods study of African American families experiencing their experiences of ASD diagnosis. And the study draws on narrative, phenomenological, and interpretive approaches to understand their illness and disability experiences. So again, it was initially an ethnographic study, but different lenses were brought to the analytical process to generate new insights. So that's something you may also come across in the literature. So to sum up, there are many different options for qualitative research design. I would say the 5 that are covered in your book are definitely the most common, in addition to that basic or qualitative descriptive. And certainly elements of these designs can be combined. And this is my refrain that you're going to hear over and over this semester, but the best design depends on what the research question is. So I'll leave you with that. Here are the references in addition to what the papers that are actually shown on the slides, and look forward to hearing your questions this week.